Namaste. Thanks for thanks to Voice of Healthcare for inviting my video for the program. This month is November, and November is Lung Cancer Awareness Month. And as many of you may not know, lung cancer is one of the very common cancers in India. It comes in first few cancers in India, and it is a very, very deadly disease because most of the patients come when it's very late. The fact is, nearly 95% of the patients come to the doctor when it is very late. To a certain extent, even doctors need to be blamed for this, because very often when the patient comes with cough and symptoms which are suggestive of lung cancer, doctors tend to take it very casually, tend to treat it as common cold or some allergic cough or sometimes tuberculosis, because the symptoms are similar. In fact, the doctor is not to be blamed for this totally, because the symptoms of lung cancer and many of the other lung diseases are similar. So the lung cancers go undetected, and many patients end up to us in a very late stage. So also, it is very important to understand that lung cancer is a disease which is associated with smoking. In fact, more than 70% of the lung cancers are due to smoking, and when I say that, you realize that the rest, the 30%, are not because of smoking. So it is important to remember that you can get lung cancer even when you don't smoke. But the idea is to prevent cancers due to smoking, which is the single avoidable risk factor. Just imagine if you are able to stop tobacco from the society, restrict tobacco from the society, immediately that 70% of the cases are going to vanish in a period of time. So that is the impact. I am aware that the government of India has brought in a lot of rules and regulations to do the same, but implementation has been an issue, and I would highly recommend that the society cooperates with the government measures, and government also implements these measures actively and are able to reduce the menace of tobacco, because tobacco is not only involved in lung cancer. There are many other cancers and other diseases like heart diseases where uh, it has an impact. So in fact, other aspect of lung cancer is also that even passive smoking within the house, say husband is smoking and the wife is getting it passively, the passive smoke, or the wife is smoking and husband is getting it passively, all these things are also involved in causing lung cancer. So my important message to the healthcare community as a whole is that we should look at advising our patients to quit the tobacco habit. When the patient is coming to you, that 10 minutes which the patient spends with you is a very valuable time. They listen to the doctor. They understand there are when a doctor tells something, it is serious. So every doctor, every healthcare professional should take that opportunity to communicate about the menace of tobacco and give them help to quit tobacco habit. There are professional helps available today to quit tobacco habit, and we should focus on helping our patients to do that. So, by far, our attempt, the NGOs like Samrohana, which is my NGO, we are actively participating in many awareness programs where we try to uh, advise people. We also have tobacco cessation programs running in many of our centers, and we all these things together would bring down the menace of tobacco in the society, and we should be able to uh, reduce the effect of tobacco and thus lung cancer in the society over the years. Remember, lung cancer is curable when diagnosed early. For that, what has been tried out is, you know, approach when there is symptom very early, and also which has been tried out and effectively been used is use of low dose CT scans done every year for people who are high risk people are those who have a habit of smoking tobacco use. So all those people, if they go for regular or yearly low dose screening CT scan, their cancers can be diagnosed much earlier, and earlier diagnosed cancers can be cured with surgery. Thank you very much.